So I'm Anna Wren, as Dr. Jericho mentioned. I'm a psychologist. Psychologist on our team. This is my colleague Garret Forshee. He's our social worker on our celiac team, and we're really thrilled to be here. This is such an amazing turnout. Sitting up here, I couldn't quite see the whole room, but so wonderful to be here with all of you and really building our celiac community here at Stanford. So today, just like Dr. Jericho mentioned, we're going to be focusing on the psychosocial impact of celiac disease. And specifically, we will be focusing on the common psychosocial challenges of celiac disease, briefly discussing how we cope effectively with these challenges, and lastly, providing an overview of the type of support, specifically the psychosocial support, you can receive here at Stanford if you receive your medical care here. So with that, I'm going to pass it to Garret to start us off.
Thank you, Dr. Wren. And just to start off, psychosocial is kind of a jargon way of saying the psychological and the social impacts of celiac disease. So that's what we're going to be talking about today. And to do that, to illustrate that, we're going to be following our fictitious character, Cedric, here, who is an 8-year-old who was recently diagnosed with celiac disease about a month ago. And we're going to go just kind of along with him in a day in the life and talk about his experience. So he wakes up, just like we all do, starts his day off at the breakfast table. Unfortunately, a couple thoughts pop into his head as he looks around the breakfast table. Looks at what his sister gets to eat. Sister gets to eat all this lovely bread here, some Pop-Tarts, some cereals that he enjoyed before, and unfortunately, he's got to change it up now. He's got to look at other options right now. It's okay, he's got some gluten-free options, but unfortunately, the old favorites, they're not there anymore. So, all right, we change our focus to school. Let's go to school and have some fun. First thing, another surprise for Cedric here is that his friend Henry brings some cupcakes for his birthday. Unfortunately, he can't partake in those again. He's got some good gluten-free snacks at school, but he doesn't get to join his friends in the celebration, unfortunately. It's all right. We got some good stuff on the docket today. We got some PE classes, and he's looking forward to playing some dodgeball. But a couple things with PE class. He's hoping that his stomach doesn't hurt as much as it did yesterday, so he can actually partake in the whole event. And then also, sometimes his PE teacher is not super happy about him taking breaks to go to the bathroom. So hopefully today's a little bit better. Gets through dodgeball, has a great time, and it is time for lunch. So we're in the cafeteria. Cedric is pretty ravenous today. He's kind of made it through the majority of his lunch, and so he's looking around the cafeteria for some options, what to eat, maybe snack or some other thing to eat to fill his stomach. And unfortunately, the only thing he can find, unlike out here today, is some fruit. And although fruit's good for us, we know that it's not always the thing that's really grabbing your attention. So he gets kind of overwhelmed, kind of annoyed, kind of frustrated, and thinks maybe everything on this spread has gluten in it, and maybe it's just better today, safer today, to skip lunch. So another kind of disappointment for Cedric here. And then it's an early release day, which is great. Him and his friends are carrying on their tradition of going to McDonald's, but unfortunately, McDonald's might not be the safest place for Cedric. And he's wondering, can I eat the fries? Can I even go into McDonald's? Is it safe to be around them? It's just a little bit different for him now that he's adjusting to the gluten-free diet. And then his soccer party, end of the year party is coming up, which he's really excited for. He's always had a great time going to a pizza place, playing some games, hanging out with his soccer team, getting the trophies. But this year's a little different. Can I get the gluten-free pizza? Is it safe? Do I have to bring something from home? Am I going to feel a little bit isolated again? So just a couple, I won't say a couple, I'll say many different aspects of this kid's life are affected by gluten-free diet and the adjustment to this new diagnosis. Okay. Next slide. So as hopefully you can see, just in one day, many different aspects of life are affected by gluten-free diet and a new celiac diagnosis. Family stress. This can look, just like Cedric kind of struggling to be at the same table as his sister, eating different things. The family deciding whether or not to have a completely gluten-free kitchen, or to kind of have different meals for everybody. Social stress, as you saw, hanging out with friends, being at the lunch table. So many of our social activities just revolve around food, and that just becomes a little bit more complicated after a celiac disease diagnosis. School functioning. So this can be, like we talked about, getting through PE class, maybe experiencing some of the physical symptoms such as brain fog, abdominal pain, discomfort, need to use the bathroom. It's kind of tough sometimes when you're not feeling great and you got to think about this stuff. Stress and anxiety not only are involved with just trying to find the gluten, trying to make sure you avoid it, but also just getting used to this new lifestyle. Depression, anger, and frustration, I think, kind of go along with the adjusting to the gluten-free diet, and kind of just the knowledge and the processing of this being a long-time chronic illness that we're going to have to deal with and change our routines up. Lastly, we do want to mention that disordered eating behaviors and eating disorders can be associated with this strict diet and can be an unfortunate consequence of that. And research has shown higher levels of mental health conditions, including anxiety and depression, among children with celiac disease. So we're talking about not only dealing with the symptoms that are precluding or before your diagnosis, kind of dealing with that frustration and that discomfort, and also adjusting to the gluten-free diet after diagnosis, and also dealing with the symptoms, for accidental exposure. So with that, I'm going to talk about, it's not all bad. There is good news at the end of the tunnel, and Dr. Wren's going to talk about that.
Thank you so much for that. And after spending this talk could probably be an hour, so we're really aware we are abbreviating some points, so please do feel free to ask questions during our Q&A or find us afterwards. But after talking about some of these really common psychological, social challenges that are related to celiac, we think it's really important to spend some time talking about, how do we cope with these challenges? Coping is very important in our lives. We want to spend a few moments talking about some effective strategies that Garret and I often recommend in clinic to really help support the psychosocial health and well-being of our children, adolescents, young adults, and even adults who have celiac disease. So first, this may seem obvious, but doesn't happen as much as we would want, is this active communication with the celiac team or your celiac provider. Now, this is incredibly important because it's an opportunity, it's a window to really communicate, what are those psychological challenges? What are the stressors? What are the social challenges that you might be experiencing? And allows for a dialogue with your provider or your team if you're here at Stanford to offer more education, to offer reassurance, to problem solve together, and generally just offer more support with the problem that you're facing. On multidisciplinary teams like our teams, it can also lead to really targeted referrals. So to Farah, our lovely dietitian, or to Garret, or to myself to really provide even more support around whatever challenge you're experiencing. Second, setting up school accommodations, a 504 plan, an IEP for those that are familiar, or if you're an adult, work accommodations, or a teenager who's working, work accommodations. And these are essential because they will ensure and support you finding gluten-free food in workplaces, in school places, outside of your home, really, and making you feel safe, comfortable, decreasing stress. Also, there's really supportive measures that can help you really focus on thriving academically, thriving professionally, managing celiac, but also really focusing on those other pursuits. For those that aren't familiar, it's things like, extensions on homework or work assignments. It's excused absences if you need to go to the doctors, if you're sick, if you have a scope, these types of supports. Private access to bathrooms, going to the bathroom anytime you need, not having to ask. So really important, really helpful for our psychosocial health. Seeking emotional support. This also may sound a little bit obvious, but it's something oftentimes we don't do. We keep emotions in. And when we're dealing with celiac, when we're dealing with these psychological challenges and stressors, the social challenges and stressors, really having your network, your loved ones, your best friend to share, to talk to what you're experiencing, your needs, your feelings. It's a great place to vent, an emotional release, but also just to feel heard and validated, like someone gets your experience. Also can lead to some helpful problem solving at times. Fourth, this is one that Garret and I are very passionate about, as well as our whole team, but is building your celiac community, like what we're doing today, building your support network. It's a way, joining a support group, going to a celiac camp. I saw a fabulous shirt on someone earlier, broadcasting the celiac camp locally. Joining a network, joining an organization locally, nationally for celiac disease, hugely beneficial to connect you, to make you really realize you're not alone. There's a whole world, a whole network of people who get the holistic experience of having celiac disease. Healthy lifestyles. This is a big one. I could talk about this for a while, so I will keep it brief, but this is so important to your physical and your emotional health. There's so many healthy lifestyle choices to make. I'm just highlighting a couple with exercise and sleep, but exercise is great for you physically, right? It keeps you active, it keeps you healthy. It's a great way on like a sports team to be social, to interact with peers, usually not around food unless there's that party Garret mentioned, but really fun, healthy ways. Also a great release for stress. And with endorphins, it can help our mood, which is always lovely. Sleep, also incredibly important for our physical health and healing inflammation. And again, that's a talk in and of itself, but really helpful for our mood as well, and really helpful in helping us cope with stress and really regulate the emotions that we have day to day to really be able to face those challenges that are common just in life generally, but absolutely with celiac. Along those lines, stress management, really, really important for our emotional health, our physical health, and coping with psychosocial challenges. So we all have stress, but when we have chronic stress that's not managed, it really can have some negative effects on our body and our GI tract, our gut. So things like more inflammation in our body, more physical tension, things that can really contribute to some of the celiac symptoms we experience, like abdominal pain. So there's no one right way to manage stress. Everyone here is a beautiful, unique individual, and we all have our ways, but some that are effective and healthy are things we've talked about, like exercise, sleep, finding your support network, as well as some really simple things that we just don't often do, like taking time to find some joy in our days. It could be 5 minutes just here and there to call a friend, to go on a walk, to read a book, whatever it is for you, to savor your coffee, your tea, your hot chocolate, your favorite drink. And then engage in relaxing activities. So it could be pampering yourself, could be taking a bath, or it could be more active relaxation, which is something Garret and I talk a lot about, things like diaphragmatic breathing, meditation exercises, yoga, could be acupuncture. Many benefits, but really targeting the relaxation response in our body and helping to decrease stress on a physiological level. And lastly, if you're noticing that you're just having very high levels of stress, emotional distress, psychological, social challenges related to celiac are getting in the way of your day and your activities, that's sort of a sign that it's important to talk to another provider, a mental health provider, a therapist, and can be really helpful emotionally, but also physically and with celiac holistically. So with that, I know many of you do receive care here, but if you are one of the families that do receive care here, there's ways to receive more psychosocial support. So an initial great way is our interdisciplinary celiac clinic. Some of you actually may have come through this clinic, but it's a much more holistic clinic in the sense of you meet with not one provider, you meet with 4 providers. The 2 of us, our lovely dietitian again, Farah, Allison, our nurse practitioner, are one of our medical providers. And while we do check in physically to see how you're doing, symptoms, we really look at celiac holistically. How is celiac impacting different parts of your life, and how can we, in that visit, provide some more targeted support? So that's a great way, an initial meeting. And then at any medical appointment, this is something so important to stress. If you're having psychological, social challenges, tell your provider, because they can grab our fabulous Garret, our social worker here, to come into the appointment, virtual, in person, really explore the issue more, provide more support, and of course follow up afterwards if it's helpful. Also, you can see me with a referral for a celiac-focused mental health visit, so evaluation, treatment. And if you need mental health support really outside of celiac, Garret and I can work with you to find therapy in the community and work closely with the release of information with that provider. Last but not least, connecting with other families and patients with celiac. We love to connect our community. So whether that's a young child, a teen, a young adult, or a family, that's something we take really seriously. And we actually, Dr. Jericho just recently got a fabulous grant for the Gluten Buddies program, and we have flyers Ashley has outside that she can give you if you're interested. And lastly, community events like today. This is how we grow psychosocial support. It's how we educate around this topic, and other events we'll be having in the future, and support groups. So thank you guys all for your attention, your time. If you have any questions, please come find us afterwards. And again, just so important to be aware of these real psychosocial challenges and ask for support and help when you need it. Thank you.